Hi, this is Joe Mullings with The Other Side. My guest today is Scott Whitaker. Scott is president and CEO of AdvaMed, which is the world's largest tech association in the medical device and diagnostics products and health information world. The members of AdvaMed are those, in fact, who make these product systems that are transforming healthcare and especially, interestingly enough, through earlier disease detection. So, Scott, thank you so much for taking time out of your busy schedule. And you're down in Washington right now in DC area?
I'm in DC. I'm at home right now, of course. We've just closed our offices, but I'm at home in the DC area and shuttling back and forth to the Capitol and to the White House working on a host of issues for our company. So, Joe, let me thank you for doing this, first of all. I don't think I've ever met anyone in this industry with greater energy and passion for medtech. And
Thank you.
the fact that you're doing this and focusing people on this issue, the value of medtech, the importance we have in fighting this COVID-19 battle is critically important. And so thank you for your leadership here. We appreciate it.
My pleasure. And thank you for being part of this initiative and the medtech leaders that are driving this, especially the first week. You stepped right up. In fact, out of the 50 or 60 people I reached out to last Sunday, I think you were the very first one on the field.
Yeah, well, thank you. It's an important time for the nation. It's an important time for this industry as well. And I think together we're finding ways to treat and deal with this disease more effectively. And we're going to come through it, and we're going to come through it a better country for it. No one wants to go through this time, but when you enter it, isn't it great to be part of an industry like this that is solution oriented, providing treatment for patients, serving the government where we can, and helping us find a better path to the future? It's a wonderful industry.
It is. And Scott, share with the audience what AdvaMed's role is in general for the industry and what a powerful ally it is for the medtech, diagnostics, and healthcare industry. And then in particular, the last couple of weeks, your initiative as it applies to COVID.
Yeah, well, good question, Joe. We're the industry leader as a trade association to help advance the policy goals and the regulatory goals of our companies globally, but also here in the U.S. We're 420 some odd members now, so virtually every aspect of medtech, every company is a member of AdvaMed. And our primary objective is to make sure the policy environment is right for our companies to be successful. And in times of crisis like this, it's even more important. As we're trying to scale up, as we're trying to create new tests, as we're trying to get new products to hospitals to deal with the crisis, these companies, as I said earlier, are absolutely on the front lines and working with government agencies to make sure the regulatory hurdles are pushed away or modified, that the procurement rules, that the acquisition models, that the distribution models are set up so that we can go back to our core business of manufacturing products that save people's lives. That collaboration is important, and we're central to making sure that happens. And it's been a tough 2 weeks, but it's been in many ways a rewarding 2 weeks as we've seen our companies respond to this crisis.
You bring up an interesting point that, classically the FDA has a very tight, constrained, and justified regulatory process, whether it's PPE, the armor of our first line responders, whether it's the respirators. What's happening right now in particular with the collaboration in regards to regular standards and policy?
Yeah, so one of the first calls I made after we realized this was going to be a public health emergency for the nation is to Steve Hahn, who's the new FDA Commissioner. Dr. Hahn's a friend. I've been with him for a number of years in different capacities. And this is a guy who understood the crisis immediately, pivoted to give us help and direction on how they can modify the typical and normal pathways on the regulatory side to expedite new products and expedite manufacturing of current products to help during the crisis. So he and I have been in very close contact. A couple days as we got into it, he got on the phone with our board. We had a meaningful conversation with Dr. Hahn. He listened to us to understand what the problems were and then immediately reacted with regulatory changes. On the front end, Joe, on the diagnostic space, where the biggest problem was in testing early, and then now on the PPE and ventilator space, the same changes are being made. And I think what the FDA is doing is critically important. There are systems that you need to have in place during the normal course of events. But during a crisis, you have to make adjustments. And they've done that. Jeff Shuren's been great. Dr. Dr. Shah, who works underneath Dr. Han, has been great. And of course, Dr. Han himself. So it's been a team effort, and we're just so pleased with what they've done.
The FDA has been plugged in, I know, into the VPs Task Force. And
Yeah.
what can you share with that in regards to additional info along the lines that those med tech leaders that might not be on the front line with you at AdvaMed at this moment in time, what can you share with them in that regard?
So I think two things. One, they're completely plugged into the task force. We are also completely plugged into the task force from a private sector standpoint, facilitating conversations between the VP's office and our companies. When a VP has a need that he sees, the call comes either directly to a company or to us, and we facilitate those conversations. Oftentimes, it then flows back to the FDA to implement, and then we're back engaged with them. So you may have seen in some of the press conferences, members of our CEOs of our companies have gone into the task force meetings and come out with solutions. And so we've been engaged with that. But it's really our companies who have led this effort. We have facilitated, we've been engaged, and we've led from what we can do best. But if you look across the diagnostic space, Hologic and BD and Thermo Fisher, and the list goes on of companies who have stepped up and delivered new product in record time. And it's been an incredible performance, I think.
The diagnostic side, I'm especially interested in, and I know the rest of our country is as well. And maybe the gaps early in, and it's easy to find fault, and we can always do a postmortem later. But on the diagnostic testing side, what sort of resources are being pushed towards that from an initiative of the government and all the other stakeholders?
Yeah, a huge amount of resources are being pushed to it, both from an acquisition standpoint, but maybe more importantly, from a regulatory standpoint right now. In order to create new tests, you have to scale really quickly, right? And to do that, you need direction from the federal government as to what the challenge is. And you also need scientific information that's flowing in from WHO and from the US government in order to pinpoint the disease and get the diagnostic treatment right. And you're exactly right, Joe. There were things that were maybe not handled correctly at the front end of this with WHO and the US government. Now's not the time to point fingers at that. The good news is when we got the call, private industry stepped up and delivered millions and millions of tests that have gone out and are continuing to go out to providers right now. We're the ones supplying the drive-through testing centers with products, whether it's swabs or the actual test itself, to understand whether or not people have the disease. And then once that is determined, then you go into the treatment phase. But it's really, really important, and those companies have stepped up in a massive way. I think the next phase is speeding it up even more, so that you're getting instant results or very short time results on the tests that are scaled. And we're moving toward a system now where we can do some of this ourselves individually, you and me, right? Doing the swabs ourselves, handing the kit back to the diagnostic company to run the test to see if we have it. So we're not threatening the providers who are trying, the nurses and docs who are trying to help us, right? That helps control the spread, which is the goal of all of us right now. So on the front lines of dealing with that as well, diagnostics companies are stepping up in a big, big way.
So there is the promise of a self-diagnostic that we can do a swipe at home or whatever that is,
Yeah.
a
Yeah.
saliva test, and then send that and get a quick response, and then just hold in place until we get that back to let us know we're positive or negative?
That's next, and I think we're working on it. I know we're working on it very aggressively, and so if that happens and it's as accurate as we hope it will be, that'll be a tremendous way to help stop the spread.
Yeah.
And it'll be good for all of us, I think, as well. More work needs to be done on that, but it's a primary focus of our companies right now.
Love to hear that. You know, and we've been hearing and seeing that quote unquote dotted line of healthcare capacity.
Right.
The good news is it's not a fixed line. Now that we've mobilized this amazing industry, that line continues to go up and up. And with
Right.
that being on the protective equipment for our frontline responders, as well as, you know, the ventilators, what can you share with me? Are there specific stories or companies, and again, not to point one in particular, but heroes out front that you have seen over the last week that should be highlighted
Yeah.
in this regard?
Yeah. To your point, not a company specific, but I'll tell you on the ventilator side, I had a conversation with 8 CEOs of ventilator companies here in the United States, all of which are scaling up manufacturing 50% higher than their capacity was 2 weeks ago. And in doing that, they're bringing in employees of other companies that might be in a different medtech space to help support the manufacturing. They're moving to 3 shifts daily, 24/7 manufacturing process, and opening up new lines as well, right? Those are heroes that are making a difference in this fight. People who are working around the clock, literally around the clock, to increase the supply of ventilators so hospitals don't have the shortages that we're afraid they might have in the short term.
Yeah, and I want our viewers to keep that in mind, is that dotted line is not a fixed line. The medtech, the diagnostic, the healthcare industry, and all the players in it are raising that line. So as we push that and flatten it out, we can pull
Right.
that endpoint in a lot closer. And I
Right.
don't think enough dialogues had around that is not a fixed line.
Yeah, that's right. You're exactly right on that. It's not a fixed line. It's also not a fixed curve yet, right? Everything we're doing to help flatten that curve is critically important to allowing this nation to get back to the normal course of business. And this is a tough, tough time. It's a tough time from a public health standpoint. There's no question about it. But if you look at our companies as well, it's a tough time economically. And we're going to feel the pinch of that soon, I'm afraid, as well, which is why we're working so hard to get America back to business as normal, so we can get on with the base work that we're doing.
Yeah, and again, that the AdvaMed organization, MDMA, and all the others that are there working super hard on our behalf, medical device companies in Washington, we can't be thankful enough to you. And the government also, again, to your point, we can go ahead and point fingers when we're done, but the aid coming, releasing that money will allow us to on-ramp a lot quicker on the back end of this.
Yes.
Because it's going to be a train wreck. It's just how quick do we
Yeah.
come out of that train wreck? Let's not mistake that this is going to be a train wreck in the eyes of emerging tech companies, mid-cap, and even the large ones.
Yeah, no question about that. It's going to be tough for all of us. We will have learned a lot of lessons once we get through it. The question, I think, oftentimes for Congress, for the companies, and for the country as a whole, did we learn our lessons from this one? Because another one's coming, right? This is not going to be the only novel virus that hits the world in the next 10 or 15 years. There's more coming. And we need to learn the lessons, both the government and the private sector, from this event. Hopefully, we manage it well so it's not as impactful as we were afraid, and then prepare for the next round, whether it's a different iteration or mutation of COVID-19 or it's a different virus altogether. This is not the end of the road for any of us, and we have to scale and be ready for the next round.
Yeah, and you've seen this before. Previous to this, you were chief of staff over at U.S. Department of Health and Human Services. You've now been at the helm of AdvaMed for a few years, and I think that we're going to see a refocus now. And you've seen this medtech industry, especially, Scott. We now understand why digital intervention is so important,
Yeah.
from a predictive
Right.
analytics to a telehealth to
Yeah.
a self-diagnosis on an iPhone. This is clearly going to jettison us into that digital age for sure.
Right. Yeah, you're exactly right. You mentioned telehealth, telemedicine. If there's ever been an example of why that's important and why it needs to be embraced by the government, by the private sector, by the doctor's offices in a very simple way, this is it, right? So you're not exposing others to the possibility of getting sick. You're controlling the spread of this disease and others. Technology allows us to do things now because of this industry and the IT industry in the medical space that we could have never done before. Sometimes healthcare systems just aren't ready to accept the change. This is a learning that comes out of this moment that I think for telemedicine, for telehealth activities, is going to be transformative.
It's a question that's going to have to be answered when this is over as well. Is forever, both investors as well as inventors and those in the industry have always said, well, that telepresence, telehealth, telemedicine, how is it going to be reimbursed? Do you think
Right.
that the industry now is going to start to look at reimbursement instead of waiting until something's been attacked, that we start to add preventive measures potentially via technology without worrying about the quote unquote reimbursement monster?
I don't think we'll ever not be able to worry about it. I think we'll have to always be aware of it. I think there are two components. One is the industry and how we price or how we propose pricing. The second is, does private insurance industry understand and embrace it? And the third is, do government insurers and the government agencies understand and embrace it, and then adjust their models according to what we can provide? And I think that's a big question. We're on the front edge of this. The governments and the insurers are lagging way behind us. And so I think we're going to have to make the case as to why this is important, why reimbursement models need to be set in a certain way, and then bring them along to embrace it. Let's use this as an example of the value of this.
Yeah, and I'm curious if our government and maybe the WHO will start to think about infrastructure that has nothing to do with an event, meaning healthcare, but an infrastructure in place and financing that infrastructure the same way for decades we've financed an infrastructure of war
Right.
against other enemies. This one is now global, and it would be interesting to think if we build that global infrastructure to respond to this before the genie gets out of the bottle moving forward.
Yeah. Yeah, you're exactly right. This is a global war, Joe. You and I know this. It's just against an enemy we can't see.
Hmm.
And it's not going to be the last one we fight. So you have to be prepared to have a global infrastructure. And honestly, respectfully, we need to make sure our U.S. government has an infrastructure ready for the next one as well. In their defense, you can't fully anticipate a novel virus.
Correct.
And you're never going to be able to fully anticipate a novel virus and the challenges that brings. But I think we can all collectively agree there's ways we can improve the nation's infrastructure so the next time it hits, we're a little better prepared than we were this time around.
Agreed. And policy always seems to lag tech for sure.
Right.
Scott, what did I not ask you that we should be talking about right now?
Well, Joe, I did want to share with you, we are in the next day or so going to announce a new set of principles that have come out of the medtech industry. What we're doing being on the front lines of fighting this disease. And we have 5 principles that will come out. We're talking about ways that we can scale and increase manufacturing domestically, but also abroad. What we're doing to make sure we're protecting our workers, I think, which is such a critical component of this, right? If you think about the workers in medtech, we need to make sure that they're healthy and safe so they can get to their places of work and continue to manufacture and produce at the levels we need. Partnering with GPOs and distributors and hospitals to make sure that we're connected both on best practices and other activities as well, and then a few other things. So that will come out very soon. The other thing I would say, Joe, on the ventilator side, we're deep into conversations right now with the government on how allocation is going to work in this new paradigm. We manufacture very well. As I said earlier, we can ramp up our scale and manufacture a lot more. But we need to get out of the allocation and distribution business during a time of crisis so we can scale up where we need to. So we will be announcing probably soon a proposal to go to the government to get out of that business and have them focus solely through FEMA, I believe, on allocation and distribution, which will free up resources for us to do our core work. And so that's coming too. We're right in the middle of that today. I'm heading back to another meeting this afternoon to discuss it. But that's an important one to mark as well.
Yeah, those are super powerful. And again, always takes an attack to harden a target, but better late than never on this one.
Yeah.
Scott, I know you're super busy. I am thankful, and I know our audience is thankful for you taking out the time and fighting a good fight for the medical device, diagnostic, and therapeutic companies up there on the Hill. Can we reach out to you from time to time over the next few weeks as things continue to evolve?
Absolutely. I'm here whenever you need anything. Call me. I'm happy to jump on another video conference as well and have a conversation. So, Joe, thanks for your leadership. We really appreciate it. The whole industry appreciates it, and we'll be better for it. Thank you.
Yeah, my honor. And this has
All
been
right.
Joe Mullings from The Other Side.